Hi everybody, and welcome to Perfectly Palm Beach. This month we have been focusing on our health. As the new year starts, it's really great to refocus our efforts and make sure that we're doing the best that we can for ourselves. We've been focusing on mind, body, and spirit. And last week we spoke with Deborah Goodrich-Royce, who has just written a book called Reef Road. The interview is on our bio on Perfectly Palm Beach and on Jayne Chase. And I suggest that you read it. It's a really great read and talks a lot about generational traumas. And it's a murder thriller. I loved it. I couldn't put it down. Today we are focusing on our body. So we are here at Sollis Health talking with Dr. Ian Russinoff about what Sollis Health is. It's a 24/7 concierge emergency ER facility. They've been popping up all over the country. Why it's good to be a member of Sollis Health, what you get from that membership, what health crises are we focusing on, what are we going to see this year? We've got the flu, we've got RSV, we've got COVID. There are lots of important issues for us to think about, and really what Sollis Health does in terms of helping you get through those crises. So come with us as we go inside to talk with Dr. Russinoff and everything that is offered from Sollis Health. So tell us exactly, Dr. Russinoff, how does Sollis Health work? Why would somebody be interested in joining?
So thanks, that's a great question. We are an alternative to the emergency department, the urgent care. We're a 24/7 center. Really, our specialty is acute care. We don't per se do primary care. We partner with the primary care physicians, but anytime you thought perhaps you needed to go visit an emergency department or an urgent care center, go to Sollis Health. We could offer better services, longer hours. You're getting a motivated group of emergency medicine physicians, a staff that's ready, willing, and able to serve you, no wait times, and we really take some of the pains out of a broken healthcare system.
And no appointments, so somebody literally gets 24/7 coverage,
Yep.
Any kind of questions, any kind of emergency care. You have a full emergency ER. What is it about our healthcare system that makes companies like Sollis Health emerge?
Yeah, so the healthcare system
and become
is
effective.
Sure.
Yeah.
The healthcare system, I would say, is broken
Yeah.
on many levels. In terms of emergency medicine, I don't know if you've been to the ER lately or in the last few years, hopefully not.
Not quite, everybody.
Typically there's long wait times. I mean, they call it the lobby. I mean, it's not a lobby, it's a waiting room.
Right.
You sit there, you could sit there for 4 hours, 6 hours, 8 hours.
Oh my gosh,
when
such
you
a
do
nightmare.
eventually
Yeah.
get into the room, if you get a room, most people get put into a hallway.
Right.
You're in a hallway for hours. They're holding patients in the emergency department that need to be admitted upstairs. So it's typically an unpleasant experience. Now, granted,
Right.
there are times and places where you must go to the emergency department. A heart attack, a stroke, a major trauma. I mean, these are instances where you have to go to the emergency department.
That are life-threatening.
Yes,
Okay.
life-threatening emergencies, and there's a few of them.
Right.
Sollis Health is not the best option. The emergency department is. But in general, other, I don't want to say routine matters, but urgent and emergent matters,
Right.
we could handle those in a much more pleasant, much more convenient, and a much more comfortable environment.
So if I broke my leg, for instance,
Yep.
I go to the ER.
Yep.
But if I'm a member of Sollis, I call my health practitioner at Sollis to kind of have you meet me there? Is that how that works?
Nope. I mean, if you feel like you have a broken leg and you're at home, you injure yourself, you either come into Sollis. We have X-ray right here. We have splinting equipment. We have ER doctors.
Oh, you would take care of me right here.
We would take you right here. Other things we could do a house call to you. We could come see you in the home. We could coordinate
I like that.
an
That's good.
outpatient mobile X-ray. In the setting of a possible fracture, it would be more ideal to come to our center because in a case like that, we have X-ray on site. We get the X-ray immediately. We splint it. We treat you and basically give you the same follow-up. Actually, I don't even want to say the same follow-up. You would get better follow-up.
Better care.
Because
yeah.
you would be treated the same way, but your follow-up, we would pave your path through the orthopedist. We have a full aftercare and care navigation team that would follow this through and to make sure you got your expedited appointment. If you went to the ER, you would get a splint. You'd get a piece of paper with the number and name of an orthopedist. You'd call. They probably won't answer. They'll tell you they'll see you in a few weeks. You'd have to call some people make some connections, ask for some favors. Maybe you get an
Right.
appointment with us. We're immediately working on the appointments on the back end, and we follow our members through.
Okay, so let's back up for 1 second. So let's talk about membership, right? This is a membership-based healthcare system, 24/7, concierge, emergency care. So what does membership look like? Why would somebody join?
Yeah, so we are your health partner 24/7. Again, primarily we're in markets that there's a high density of concierge medical practices. Membership looks like immediate access to care. We should be your first call for any of your immediate health concerns, acute care. It's really not just routine care, it's more of like acute care. And even for young, healthy people with no medical problems, you're more likely to need the urgent care or the emergency department than your primary care physician. So Solace Health fills that role. I think we're in a very unique space. I think we're pretty much the first player of a space that looked at the urgent care business and thought, wow, there's an urgent care on every corner. What differentiates this one from that one?
Right.
But we have taken it to the next level. We're not just like an urgent care. We have emergency medicine capabilities. The physicians are all emergency medicine trained and in their prime. The nurses have critical care and urgent care expertise and background. Our staff is ready, willing, and able. You don't have to go through that wait of the lobby, as we call it, or and be put in a hallway. You're brought immediately back. And we take a rather painful and inefficient process, and we kind of take some of the pain points out of that for our members' comfort.
So you just mentioned if you're a young person with no underlying conditions. To me, you know, we live in an area where the ages range from 25 to 95, particularly in a place like Palm Beach or Palm Beach County. So are you seeing an older population really coming in and utilizing your services?
So interesting, it's a great question. When I first joined, I left a traditional emergency department in Broward County, and I figured I'm going to Palm Beach. It's going to be generally an older population. We actually see a ton of pediatric patients. We see the whole, every generation. And actually,
I love hearing that. I mean, I don't mean to interrupt you, but I do love hearing that because everybody thinks of Palm Beach as kind of being a place where everybody comes towards the end of their life. They retire and it's old, but it's not. It's young, it's vibrant, it's
and I think our demographic is probably different in our other locations. We're in California, in Beverly Hills and Santa Monica, and we're in New York City on the Upper East Side in Tribeca. We're in the Hamptons. But in Palm Beach, per se, there's been an influx of young families. And what we offer to those families, you know, access to their children, even seeing a pediatrician. Typically, pediatricians work 9 to 5. Maybe you go through a traditional option, maybe you choose concierge, but regardless, it's typically Monday through Friday, 9 to 5. And, you know, we are open 24/7. We do sutures, we have x-rays, we diagnose broken bones, we do procedures. We basically are an extension of the pediatric community for these after hours, weekends, nights, and holidays. So we actually see a large number of pediatric patients. We have our older geriatric patients too. Don't get me wrong, we have a lot of those.
There's that super handsome guy on Instagram that you and I were talking about before we started filming. He's so handsome, and he really made me feel, he got to me because he was saying the great thing about Sollis Health and the great gift you can give your older children is that if you are sick at 3 a.m., they don't have to worry about you because they've got Sollis.
We're posed with interesting questions all the times. I mean, even grandkids that are visiting grandparents, like over Christmas break or a holiday, they'd want a place to go. Now, we have to, you know, it's a little tricky with regards to the membership structure. You have to be a member. You could come in on a one-time fee, whatever. But
wait, you can come in on a one-time fee?
Yep.
We
have options for non-members if they want to come in on a one-time, like a temporary access fee, and transition that into a membership. So we will see people who are non-members, and we have a process for that. But we are a resource and an area of comfort for people who, say, are out of town and don't have access to their local primary doctors. And again, with the pediatric population, we're trained emergency medicine physicians, so we see all age ranges here. We're very comfortable with, you know, ear infections and sore throats and, again, lacerations and procedures, broken bones in kids. So we see a lot of pediatrics.
So you see everything. So let's really talk about it. I mean, the country has been dealing with a triple pandemic at the moment with COVID and RSV and
flu.
Right, exactly, an acute flu, a flu that's different from other seasons, right, exactly. I got my flu shot for the first time, I think, in like 25 years. So are you seeing most problems in those areas, or are you seeing other health issues?
We see it all, cardiac issues, trauma. I mean, we see it all, but I would say that primarily, like probably our most common chief complaint has to do with respiratory viruses or infections. I mean, because we have the tests and they're easy to diagnose: strep, flu, COVID, RSV. We run a panel like looking for all the respiratory viruses. And still coming out of like the COVID pandemic, it's still first and foremost on most people's minds.
It is.
Whether it's social gatherings,
It's become
weddings.
again.
Yeah.
Yeah.
So, and it just keeps coming back. It's like the gift that keeps giving, but
Right.
it just keeps coming back. But
In other forms.
Yeah. And in this particular season now, so like you mentioned, flu, we saw an earlier flu season this year. We know
Right.
people aren't wearing masks and probably not washing their hands and not as cognizant as they were, say, a year ago.
Right.
So flu season came about a little bit earlier. RSV happened to be particularly rough, especially with the older population this
Right.
year. So I think that combination of events did lead to, a heightened awareness of respiratory infections. And we are frequently asked to just perform these simple tests and look, for the most part, there are treatments actually available now. So some might say, oh, it's a virus. What do you do for it? Well, the truth is, if you have flu and you're within the 48-hour window, you can take medicine. If you
Right.
have COVID and you're within the window, you can take the Paxlovid or
Paxlovid,
the pills.
yep.
If you have RSV and you want to kind of know this, because especially the older population, they may be more at risk for wheezing or what we call bronchospasm or respiratory distress, in which case steroids and inhalers. So
there are things everybody can take. Right.
So there are treatments for these types of illnesses.
So what is this para-influenza? I've been hearing about that. I've never heard of that in my
Oh, really?
life. Yeah.
Yeah, parainfluenza has been around for forever.
Oh, it has?
Typically it causes croup in kids.
Yes.
The croupy, barky cough
Right.
that has been scary to young kids.
Yeah.
They wake up in the middle of the night.
Yes.
You rush them outside, you put them in a steamy shower, you rush to the ER.
Yes.
But parainfluenza is
The
just
hours
another
I've spent
yeah.
in the steamy showers.
Yeah,
in
it's
my
just
life.
another virus. But I think just all respiratory viruses have garnered much more attention the last few years.
Right.
So we're seeing something called human metapneumovirus when we when we do
What
our
is that?
respiratory panel. It's just another virus that has been around forever. But now that we're testing, we're finding. So
And what are the symptoms of that?
all of these viruses typically cause the common cold. Sore throat,
Okay.
congestion, runny nose, a cough. It could be a productive cough. It could be a non-productive cough. But they all carry the same symptoms. So we have the technology now to kind of search for it and get you the answers. Oftentimes, if it's viral, the truth is it doesn't change your management, but it does kind of give you the expected course and know how to plan for this accordingly.
Yeah. Okay. Are you seeing other things that you're like shocked by? I feel like we've been living obviously in this, very difficult health crisis, kind of chapter of all of our lives across the country. So I think everybody's kind of poised like, okay, what's next? We're
Yeah,
all waiting
yeah.
for the next shoe to drop.
Yeah.
And so you're just seeing this bubble of these kinds of these things. You're not seeing something that's, oh no, everybody, here it comes.
Right. Yeah.
No.
I've been doing emergency medicine for 20 years, so I have to say nothing surprises me.
Okay.
I thought I saw it all before COVID,
Right.
and then we get thrust into the pandemic a few years ago
Gosh,
at the hospital,
incredible.
and we have tents outside, and we're wearing suits, and I remember the first colleague of mine that saw a COVID positive patient. He went to the room fully gowned up, and when he came back, we were all looking like, is he okay? He literally saw the patient
Right.
5 minutes earlier.
Right. Is this Ebola?
Yes.
Like everybody
And
was
that's-
totally
yeah.
panicked about it.
So, I don't know what will be next. I'm sure in a few years we will find something and say, I can't believe I've never seen this before.
Right.
Because,
Oh my gosh.
But this is just
Because everything ebbs and flows and changes and mutates, right?
Yeah, this is the world we live in. But the foundation of Solace was not to be like, the greatest resource in terms of COVID. Now, granted, we had access to the monoclonal antibodies, which was the treatment everybody wanted. We would do it as a house call. We'd get people better. More than anything with COVID, I think we were just available for people's questions and concerns.
Which is awfully nice.
They got an honest and sincere medical opinion. They knew they could speak to a provider 24/7.
There's a lot of misinformation out there, so it's nice to be able to pick
Yeah.
up the phone and call somebody
Yeah.
and get it clarified.
Yeah, I actually was talking to my mother last night, and she was telling me she has friends, and she lives in South Florida, and some of the doctors are still giving Z-Paks for COVID. Like, they hear their patients have COVID, so they give them an antibiotic, an oral antibiotic. And it's like,
Seriously?
there's no science
Oh my
to this.
gosh.
It's bad medicine, and it's like...
It is bad medicine, yeah.
This does not happen at Solace. You're going to get a provider 24/7. You're going
Right.
to get an honest opinion, and most importantly, you're going to get someone who's going to follow up with you the next day or two to make sure you're headed down the right path.
Right.
The unsung hero of Solace.
Which is so nice.
And we haven't really touched on it yet, and I'm sure we will, is our aftercare team. Like, that is one of the missing components of medicine. Probably
Right.
the biggest is the
Right.
follow-through. Many times in the ER, I've seen over 100,000 patients in the ER. And believe me, my intention was, I wish I could have followed up with all 100,000 of them or
Right.
whatnot a day or two later just to make sure they were doing better.
Yeah.
But that's
I'm
not
sure.
the case.
Yeah. Because you can't get that emotionally involved in an emergency ER setting.
But even so, I'd come in the next day, there'd be 5, 10 people waiting to be seen. I have to hit the chart rack, and it was just like a vicious cycle. There was no following up. With Solace, we follow with our patients almost ad nauseum to the points where they tell us, okay, we're good now. You could stop checking in on us. And that's really what's missing. But you take that with COVID, and people had tons of fear. They didn't know if they were going to live or die. When I first had COVID, I had it in March 2020. I mean, I had a mild case, but the first thing I did, I was in the guest room. I had a pulse ox next to me. I should have invested in the pulse ox business in February when it was
a pulsometer that you stick your friend that registers your oxygen levels.
Yeah. And I would wake up in the morning, and the first thing I would do is I would put my pulse ox on. I would give a few deep breaths.
Oh yeah, me too.
Okay, I'm still 98%.
Yes. Oh my gosh. Exactly.
But to have a source that I could just ask questions and get concerns and know I can call anytime, all day. Imagine, without our practice or a practice like Solace, you're trying to call your physician. They don't know the answers. They're probably not calling back in a timely manner. People are concerned.
You have to wait all day.
So yeah, so we have therapeutics, but in really more than anything, we had access and availability.
So are you on the phone with your patients, or are you on Zoom with them? And is telecommunication a big part of what Solace offers?
Either or. I mean, we do telemedicine visits. It could be it could be video. It could be audio. Right. I mean, it could be text. I mean, just even sending through one of our telecommunication platforms like Spruce. We text with our members. But just to follow up and to check in and to know our patients have somewhere to go and someone they can ask is just huge in the setting of this pandemic.
Exactly.
And again, we're still seeing it now to today. I mean, there's varying degrees of anxiety about COVID. Some don't care, and others are still extreme and still test pretty much regularly.
It's very true. Even though in South Florida we're lucky we can be outside a lot and restaurants are open, but in other locations for Solace, it's winter, it's cold, people are inside. So I'm sure there's a little bit of a different varying.
Oh yeah, there's definitely. And again, our New York and California markets, and even so, we started Solace here in Palm Beach about almost a year and a half ago. But I think even our COVID experience was different last year, because New Yorkers would come down to South Florida. There was a pretty big COVID wave last December, but our restaurants were open and people were at the beach. And then they would go to New York, and restaurants were asking for vaccine cards, and that was just not the case here. So I look forward to Solace getting back to our mission and vision, which is, again, being an alternative to the emergency department, seeing acute level patients, heart issues, abdominal issues, lung issues, infectious diseases that are not respiratory in nature, urinary, sepsis, and then that's really the bread and butter of what we're trained for.
Right. So we've been focusing this month on health, because January is a great time to kind of reset one's body and kind of focus on it and get new habits going. So we've been doing body, mind, and spirit. So are there things that you do personally and you do for your family to make sure that you can share with us that kind of keep you healthy and centered and grounded? And
Yeah, I mean, personally, I've taken a few steps back in the last few years, but I was a pretty avid CrossFitter for many years. Unfortunately, my knee and my shoulder and my joints haven't kept up with my mind, so I'm kind of limited. But I still try to instill in my family, my wife and kids, how exercise is important and getting out. Right. For us in Florida, I mean, look, even if it's just walking 30 minutes a day, 3 or 4 times a week, just do something outside and take advantage of the environment. But I do believe personally, I prefer a high intensity exercise. Just, I've had to space it out now. I used to get up at 5 in the morning and I was obsessed. Now it's a couple of times a week. I try.
Right.
So, but I still think exercise is the important. We talked briefly before we started about just the delicious restaurants and enjoying the finer things. So many great
restaurants in Palm Beach and West Palm Beach,
and enjoying the finer things that South Florida has to offer. And to me, this is just my personal lifestyle. I would trade off those great restaurants by exercise as opposed to not living life's greatest things, which I think is food and
Exactly. We're here to enjoy ourselves. Yeah. Exactly. Do you meditate?
I don't meditate, but I think there is definitely value.
So for your spirit, you're saying you just want to focus on kind of enjoyment and enjoying life and being outside?
That's my personal feeling, but meditation. And I think even with my kids, and my kids go to camp in the summer, they go to summer camp up in New York. I think, and maybe on the spectrum of meditation, just putting down your phone and turning off the electronics and just being in your natural environment. Go play some sports, go hang out with the kids in the street. Just turn off the screen. And it doesn't have to be quiet like meditation, But I just think it's healthy to kind of like get away from the device
Yeah,
or
I'm
get
right
away
there
from the
with you.
computer.
Oh my God, I'm
So
right there with you.
everybody, for some people it's meditation, it's quiet. For others it's yoga.
Right.
For others it's Pilates. I mean, you really just got to find, what
thing that
works for you.
Exactly.
And if you're passionate about it, I mean, the exercise and, could come in many forms. I will say, COVID, this pandemic, I mean, it's taken a huge psychological hit on our youth.
I agree.
So in terms of like things we could do for mind and spirit, I think that as parents, we really need to just pay attention to the fact that our kids also went through this rough patch of not going to school and they're depending on technology.
Yes.
And personally, like the greatest part about my kids going to summer camp is that they don't have their phones. And again, I know most of us, like I can't survive without my phone, and I'm addicted. And we've been talking for 15 minutes, and I haven't looked at my phone. That's the longest it will be the whole day today.
Yeah. Well, part of our health is also making sure that we have mental health, right?
Mm-hmm.
That our mental health is as healthy as our body, and because I really believe that mind and body just affects each other so much. And I think that really is what came out of the pandemic, don't you?
Oh, absolutely.
Yeah.
Absolutely.
I mean, the acute awareness of that.
Definitely.
Yeah.
Yeah.
And I think it's great that we're all talking much more about mental health and anxiety and depression. And, I mean, life isn't perfect and things, people get curveballs and health issues and things that affect them. So it's great to be able to sort of take care of all of those things, right?
Yeah. I think unfortunately there's a shortage of now psychiatrists or psychologists going forward. And I think as a result of the pandemic, there probably will be a greater need for this 10, 15, 20 years down the road.
I agree.
And we need to get some of these people in training now to help our youth.
Right. And the new babies that have gone through the pandemic, right? That were wearing masks and it has to have affected them.
I just had this conversation with a friend the other night who, like his nephew was in town and maybe his nephew, I think he's 2.5 or 3, but didn't recognize what somebody looked like without a mask, until about a year ago.
Exactly.
And imagine being a newborn or a toddler and
can you imagine?
all you see are people wearing masks, and that's how they
No.
entered this world. So
Yeah, exactly.
there's definitely going to be some long lasting effects.
I agree.
We need to make sure we have resources in place to help people.
Yeah, I agree. Okay, so give us some tips or some tricks for staying healthy if we don't wear masks because we're outside all the time. I mean, in terms of this triple pandemic that we're facing. So are there any things that you would suggest for everybody to do?
I mean, they're basic and common sense. Hand washing is huge.
Yeah.
Like people take this
But
for
you do it the whole
granted.
time. You've got to like sing happy birthday, right? It's not just like in and out, under the water and soap up and you're done.
They make us, through the hospital and stuff, they make us take a course. It's like 20 to 30 seconds and you have to have a certain amount of time.
I think that's happy birthday.
It's unrealistic. Let's not, I mean, who are we kidding? I mean, people don't have this much time, but it's just being aware of hygiene and personal space. I think avoiding elevators if you can. I mean, it works on
crowded
multiple
elevators.
levels. Yeah, I mean, you can't. I'm not saying don't go to a restaurant or wear a mask at all times.
Right.
But like, don't go into a crowded elevator if you're going up 2 flights of stairs. It's better for your health to walk a couple of flights. And why would you want to be around shared air with people? So
Exactly.
I think it's a lot of common sense. If somebody is sick or a household contact has an upper respiratory infection, and let's say it's not COVID. But why do you need to hug all over them or be on top of them? Still, try your best to distance.
Right.
So I think that a lot of this is just common sense. And then look, you could do everything right, and it still might get you. It might get you. And you didn't do anything wrong. It's just this is the world we live in, and germs are in the air. But you just got to take an extra few steps, precautionary steps to make sure that you make wise decisions.
Let's just review the key components of Solace. No waiting, no appointment. What else?
Yeah, so
let's just review it for everybody.
Yep, I'm happy to discuss this. I mean, this is really my pride is here. We can see people 3 ways basically: in our centers, in our brick and mortar location, on a house call, or via like telemedicine.
Okay.
And we have amazing physicians, full-time doctors, emergency medicine trained. We're just going to take the best care of you, whether it's again in person, over the phone, or at your house. Even as a physician, whether I was in the ER or whatnot, you get one shot to take care of a patient. You make a plan. Having aftercare and care coordination, just manage it after the fact, just gives me peace of mind and comfort that if we miss something the first time, we'll get it right the second or third time. And you don't have to go back for another visit. We'll follow up. We'll see if things progress. And that's the component that's missing from healthcare. Typically, people
it's
will
usually
go to
very
the ER,
impersonal, right?
Yeah. And we call it a bounce back. I mean, they'll just bounce back and, they'll come to another ER, get another opinion. But really, for me, the comfort is every morning we ran with the team. We go over all of our patients that are active on our list. We speak about the higher acuity patients in more length. But we really follow through with our patients until I'm comfortable and the team is comfortable that they're headed down the right path. And I sleep well at night knowing that, we have this one shot to see our members, but we get to back that up with constantly reassessing them. There's open lines of communication. Most of the members
24/7.
And even so, most of the members, they have my cell phone. If they don't have it, they should have it. I don't mind them calling. Maybe I'm tired, maybe it's late, but you know what? I'm happy to partake in their health care, and I sleep better knowing that they have answers and they're not scared and there's no fear.
Right.
We're 24/7. So for us, just being accessible at 2 a.m, if somebody is scared or they're having chest pain, they don't want to go to the ER, they're, have fears of getting, calling an ambulance, we're available to them. So
I'm ready.
Yeah,
Yoshi and I, we're ready. We're ready to sign up.
I think we're in a unique space. And
no
again,
question, it's
you
great.
could look at the website and it talks about, not going to the ER, not waiting in a hall, being accessible. But honestly, I'm just so proud of our team, the way that they go above and beyond for our members.
Very cool. I think
it's awesome. The way
awesome.
that they follow up with our members, and I think we're doing a great job here.
Yes, I think you are too. So I'm a big advocate, and people talk about it all the time. So I'm so happy to have spent some time with you this morning. Thank you so much. And we're really excited to get all this information out about Solace and why somebody should join this incredible team of medical professionals.
Yep.
Thanks, guys, for joining us on Perfectly Palm Beach. Thanks so much.